Hello, I'm Professor Margaret Gonzalez-Perez from Southeastern Louisiana University, and today I'd like to talk to you about how the COVID-19 pandemic is disproportionately affecting women. As the United Nations Women's Council says, the impacts of crises are never gender neutral, and COVID-19 is no exception. This is a systemic inequality that the pandemic is laying bare. Women typically earn 82% of men's earnings in the United States, and in many states, that's even less. Women are also more likely to have jobs in the informal employment sector, meaning that they don't pay into a social security system or a public insurance system. That means that women have less access to social protections, like healthcare systems or retirement plans. And women are also more likely to be the heads of single-parent households. That has led to something known as the feminization of poverty, meaning that women and children make up the majority of those who live in extreme poverty in the United States. In addition, women occupy many of the jobs that are considered frontline work, and they are at risk during this pandemic, operating as healthcare workers, grocery store clerks, fast food workers who are exposed to the pandemic. Women are also subject to the domestic violence increase that has occurred during the pandemic. With job losses and school closures, families are forced to be at home alone together, and this has created very dangerous situations, not only for women, but for children. And this brings us to something called intersectionality. In 1989, Kimberly Crenshaw coined the phrase intersectionality, referring to the layering of factors or variables such as gender, race, and class. And what she meant was that a woman might be discriminated against because of her gender, but she might also be discriminated against due to her race or her class. And these don't just have an additive effect, they actually have a compounding effect. So being female, a person of color, and from a lower socioeconomic class can be devastating. Looking at job losses for women in the United States, 5.5 million women have lost their jobs during the pandemic, compared to 4.4 million men. And even though women made up 47% of the workforce in 2019, they have accounted for 55% of all the jobs lost during the pandemic. And women with higher education are actually less likely to return to work than men with higher education are. Married women are also less likely to return to work than are married men. And only 2% of the women who lost their jobs have made the transition to self-employment, compared to 37% of men who lost their jobs and have been able to start up their own businesses. Self-employed women prior to the pandemic were 6% more likely than men to close their businesses. And women accounted for 100% of the net job losses in December 2020. 31% of women are unemployed and looking for work now. And women's participation in the workforce hit an all-time, or hit a 33-year low in January of 2021. Now, in this graph, we can see the difference between the increase in women's unemployment and men's unemployment. If we look at the bars below the line, that indicates men's unemployment rates growing faster than women's. The bars above the line indicate women's unemployment rates growing faster than men's. And we can see that women's rates have risen in the past, for example, in 1954, 1961, 1970, but they have skyrocketed above men's unemployment rates during this pandemic. So this has been particularly tragic for women's job losses. Why? Why have these job losses occurred? Why are women in these situations? And one of the reasons is unpaid work, what is sometimes known as the double burden that women bear. Women, even if they work outside the home, are typically responsible for childcare inside the home. Even if they're not responsible for 100% of the child care, they're responsible for the majority of it. Women are also responsible for elder care in the home if the couple has elderly parents or elderly grandparents that need to be cared for. Women are also responsible for taking care of any family members who might be sick. So if there is a child who is sick and has to stay home from school, or a child who has a chronic illness and needs constant care, women are the ones providing that care in most cases. Women also tend to be responsible for the majority of household cleaning, which is yet another chore to add on to this burden, even if women are working outside the home. Women also tend to be responsible for cooking and menu planning and buying and transporting food, in addition to preparing the household budget and making sure that the family remains within that household budget. And if children are in virtual school, if they're attending school remotely, women are typically responsible for the supervision of that virtual schooling, even if they are virtually working remotely themselves. In some cases, women have jobs where they simply cannot do those jobs remotely, and this burden of supervising virtual schooling becomes unmanageable for those women. And in our societies, women have become the social safety net. Before the pandemic, women were responsible for 75% of 16 billion hours of unpaid work worldwide. In some parts of the world, that was closer to 90%, and so it has only increased during the pandemic. And even in more developed nations, women are usually the default caregivers. If one parent is required to stay at home, it often makes sense that that would be the person who has lower pay, but that usually means that the woman has to stay home. And parents actually feed into this problem, requesting the help of female children more than males. And this primes girls for their caregiver role and primes them to give up any kind of career role. And governments themselves are reluctant to provide social services pre-pandemic or during the pandemic because women already fill that role. And governments don't want to be pushed into taking care of social services that can be provided for free within the home by women. And women who are no longer seeking outside work are not even counted in these unemployment statistics. And so that actually artificially lowers women's jobless rates, because many women have had to give up their jobs due to the need to provide child care or elder care or some other kind of care within the home. And those women aren't looking for work anymore because they can't work. And so they simply vanish from these statistics. There's also something called the mom penalty and dad premium, which essentially means that there is a penalty for being a working mom, but there's a premium for being a working dad. Almost 10 million mothers of young children were in the 2019 U.S. labor force. And in those situations, if one parent has to stay home, the mother typically quit her job because she earns only 82 cents for every man's dollar. And so childbearing women quit their jobs just as their wages are rising, while men continue to work uninterrupted, even if their families are having children. And for women, a one-year job gap results in a 39% loss in lifetime earnings. That's more devastating because women are more likely than men are to rely on Social Security benefits when they retire. And those Social Security benefits are calculated from a lifetime average of earning. So any time out of the workforce reduces their retirement benefits. 1/3 of unemployed women aged 25 to 44 have said that the lack of childcare was their cause of leaving the workforce. And pandemic-related loss of childcare has affected at least 2.25 million families. So this is a serious crisis. Another problem that women face is working on the front lines during this pandemic. Overall, women make up 64% of frontline workers. 78% of nurses are women, 86% of health support workers are women, like certified nursing assistants, and 23% of those health support workers are single mothers. That's a job that they cannot do remotely, and yet they're still responsible for taking care of their own children and supervising their schoolwork. 81% of pharmacy technicians are women, 71% of retail cashiers are female, 64% of salespersons and customer service representatives are women, 80% of domestic workers are women, and 67% of fast food workers are women, although only 18% of fast food executives are female. And 73% of social services workers are women. And during the pandemic, the demand for social services has increased dramatically, meaning that there is an even greater burden on those women. Now, we discussed intersectionality, and these intersecting oppressions of gender, race, and class have a huge effect on women during the pandemic. Over 41% of frontline workers are non-white. Over 17% are immigrants, and over 33% are low income. 10% of frontline workers are uninsured, and 1 in 8 households has experienced food insecurity since the pandemic started. And for women who are not college educated, they are 3 times more likely to lose their job in a pandemic. So these different variables of race, of class, of gender, can have a compounding effect, as we said before. Domestic violence is an additional problem during the pandemic. In the United States, it's reported that domestic violence has increased 8%. The United Nations says that globally this is closer to 20%. And this increase is due to the fact that women are often isolated with their abuser due to job loss and adults being at home. The stress of close quarters, where the entire family and perhaps multiple generations may be forced to stay in a home together. And then women have no job or income to escape. And so if women have no alternative, they're forced to accept this domestic violence. And among the disenfranchised minority groups, there are even more reports than average. Some other problems that are of a more global manner have been affected by the pandemic as well, such as global human trafficking. Human trafficking is defined as the use of force, fraud, or coercion to obtain labor and or sex, and 80% of the victims are women and girls. So the pandemic has had an impact on these women because there has been a global increase in human trafficking of 185%, according to UN sources. And there's more access to human trafficking through online recruitment during the pandemic. And there's less oversight by parents and institutions during the pandemic. And an additional problem is that with job losses, women and girls have become desperate for income and have resorted to sex work. There's also more demand for illegal sex and narcotics during the pandemic. And an additional 13 million girls worldwide have been pushed into child marriage because of economic pressures at home. An additional 2 million girls have been subjected to female genital mutilation because their cultures require that women undergo genital cutting prior to marriage. And parents simply can't afford to keep girls at home any longer with the pandemic job losses. Now, what are the solutions to this? Well, internationally, it's possible to work with the United Nations. The United Nations is willing to provide data to accurately assess national and global gender problems. It's also possible to provide more equality and economic options for women to avoid domestic violence and human trafficking. Flexible work schedules and optional remote work would also help. provide keep women from being at risk in some of these job opportunities. And providing government-funded childcare and job retraining programs for women would help. Government-funded childcare would free up women to return to the workforce, and job retraining programs would allow women to find alternate jobs to the ones that they've lost. And national recovery plans need to emphasize women in their recovery. Within the U.S. specifically, the government should restore enhanced unemployment benefits, provide more stimulus payments that are more reliable for women, and particularly single-parent households. And the government needs to restructure childcare systems and social services. In 1935, a program called Aid to Families with Dependent Children, or AFDC, was created during the Depression to discourage women from competing with men for jobs. So it can be done. During World War II, the Lanham Act was passed by the U.S. Congress to establish subsidies for childcare to keep women working in their defense jobs. So when the government wants to, it actually can come up with solutions for these dilemmas. I hope that you've enjoyed or at least learned from my presentation today, and I look forward to hearing any feedback that you might have. Thank you very much.